before Bucs camp could even start, and before anything could even happen, according to some fans, all hope has been dashed, all dreams have been shattered. Everything in Bucs land is no longer going to be amazing. However, you are Greg Auman, and you know best. You know how to keep a level head. You've been here before. So, a couple of days ago, the news comes out that Tristan Wirfs has some knee soreness. They go in there, they take a look around, they find out they got some other things going on in there, and they want to take care of it. And the reports coming out are they're iffy, they're weird. First it comes out, he's going to miss a couple of games, maybe 1 game, 3 games. Now he's going to be on the PUP list, which means 4 games if I'm not mistaken. What is actually happening? And has he actually hit the PUP list yet? And could you explain what all of that really does mean, Greg? Also, welcome to the show.
Yeah, thanks for having me on. Really, I mean, nothing's set in stone at all. He's had the surgery. We're talking about 10, 12 weeks away before he's back, but they'll probably put him on the PUP list for the start of training camp. You can come off the PUP list at any point. The only problem with PUP list is if you're on at the start of the regular season, then you have to miss the first 4 games. That's the only thing that's really set in stone here. If they decide there's a decent chance he might be back less than 4 weeks, they can start him on the 53 and just have him inactive. That's kind of what they did when Chris Godwin was coming back from his big surgery a couple of years ago. So again, right now, it certainly looks like he'll miss the start of the season, but I don't know that PUP list is decided at all right now in terms of him starting the year. He's got 2 months of rehab and recovery before they have to make any kind of decision about what they're doing there. So, it's a significant loss. I mean, when we were at minicamp, we saw him out there held out with a brace on his knee. That's a red flag. That's a big concern. And Todd Bowles was fairly dismissive at the time. Said it was precautionary. It'll be fine for training camp. But again, I mean, it's something that had bothered him, last year, kind of played through at the end of last year. And I think, again, we don't know exactly what he's dealing with or what changed, but seemed like the kind of thing you would try and rest and rehab and avoid surgery. And clearly there's more to it and something that needed to have some surgery. Not a huge thing. Go ahead.
Greg, what the heck happened?